IVF is a process by which patients come to our center and they're evaluated for the right procedure. First, we determine a patient's dose of medications based on her age, her height and weight, her ovarian reserve tests, and her ultrasound looking at her ovarian follicle count. Patients will typically stimulate for about 8 to 10 days on daily dosages of injections at a dose that is optimal to cause follicle or egg growth at not such a rapid pace or at not such a slow pace, and for the right quality and quantity of eggs. Once we extrapolate that data and determine the day of the egg or oocyte retrieval, another injection is given called HCG. This is the last injection that will cause the eggs to mature to be ready for the IVF extraction process. We then go to our surgical suite, by which a patient will get an anesthetic so that she is asleep through the entire procedure. A tiny needle will go through the back of the vagina and into the ovary and into the follicles, and the oocytes will be collected, and the oocytes will be sent to the IVF lab for processing and fertilization. The embryo will be in culture in the laboratory incubator for 5 days. On the 5th day, the embryo has divided multiple times till it is an advanced embryo known as a blastocyst. The ability of a laboratory to culture blastocysts is extremely important because it allows for selection of the strongest and typically healthiest embryo for embryo transfer. The most ideal candidate for IVF is a patient that has a tubal blockage. Those patients typically are not infertile, but have a blockage by which the sperm and the egg cannot unite in the fallopian tube. These patients will have the highest pregnancy rates for IVF, upwards of 70 to 80% in women under 35 with 2 embryos. Patients that are getting eggs extracted using an egg donor also have very, very high pregnancy rates, very similar to patients with tubal blockage. I would say the next group of patients that have very, very high prognosis are patients that have mild to moderate Malefactor or unexplained infertility. These are patients that have attempted artificial insemination or intrauterine insemination without success. Those patients also typically have very, very good pregnancy rates through IVF, on an average of 60 to 70% with 2 embryos under the age of 35. What we observed in the data that's been published is each 2 to 3 year increment after the age of 35 will correlate with a significant decrease in pregnancy rate, such that women over the age of 43 will experience pregnancy rates in the low single digits. IVF pregnancy rates are tied to the age of the female egg, not the age of the patient, but the age of the egg. In other words, a 47-year-old woman using a 21-year-old egg will have the pregnancy rates of a 21-year-old egg. If you transfer a single embryo, you may have a slightly lower success rate. However, if that embryo is screened through genetic testing or pre-implantation genetic diagnosis, you may still maintain very, very high success rates, very close to 2 embryos, and lower the risk of having multiple births.